Okay, this is a tutorial on the Care Select Imaging Open Access Portal program. A little bit of background history. The Protecting Access to Medicare Act of 2014 established a new program to increase the rate of appropriate advanced diagnostic imaging services furnished to Medicare beneficiaries. And examples of advanced imaging services include CT scan, PET scan, nuclear medicine imaging, and magnetic resonance imaging, or MRI. Under this program, when an advanced imaging service is ordered for a Medicare beneficiary, the ordering professional will be required to consult a qualified clinical decision support mechanism, or CDSM. A CDSM is an interactive electronic tool for use by clinicians that communicate appropriate use criteria, also known as AUC, to the user and assist them in making the most appropriate treatment decision for a patient's specific clinical condition during the patient's workup. The CDSM will provide the ordering professional with a determination of whether that order adheres to AUC, does not adhere to AUC, or if there is no AUC applicable. For example, no AUC is available to address the patient's clinical condition in the CDSM consultant. The CDSM that we will use in LifeCare is called the Care Select program. I'm going to take you in a little bit through the steps required to access Care Select and generate the information required on every advanced diagnostic imaging order for Medicare beneficiaries. You can access the Care Select program from the Holy Redeemer intranet page, the Holy Redeemer internet page, which you can get to by going to a web browser and typing in www.holyredeemer.com, or you can directly access the Care Select website from a web browser. You will initially need to create an account and save your username and password. If you will be ordering advanced diagnostic imaging while outside of St. Joseph Manor or Lafayette, it is recommended to bookmark the Care Select webpage in your web browser for easy access in the future. When ordering one of the advanced diagnostic imaging tests, you will need to access Care Select, enter the patient's age and sex, and then select the service to be ordered. You will be asked to select an indication for the test. Be sure to select the most specific symptom or diagnosis as the reason for the test. Do not select something like rule out. Check off the box with the most appropriate reason, or select can't find a match. A list of tests, including the test you have requested, will populate with the appropriateness score for all of the tests. You can select the test you ordered or alternative tests as suggested. Then you will click Select this service, and a pop-up box will appear containing 3 items: a decision support number, an HCPCS code, also known as a G code, and an HCPCS modifier. All 3 codes must be entered on the test order to be sent to the imaging department. In order to facilitate this documentation, you can select Copy to Clipboard, and the information can then be pasted into the box Type of Diagnostic Test in the order in Point-Click Care. I just want to mention some special considerations, and then we'll show you how this is accomplished. The procedure must be completed for all Medicare patients when an advanced diagnostic image test is ordered. Tests with a low appropriateness or indeterminate appropriateness score will still generate the decision support number and the HCPCS code and modifier. Every effort should be made to avoid telephone orders for these tests so that the order placed by the physician in Point-Click Care will include the required information generated by Care Select, copied and pasted into the order. If a telephone order must be given to the nurse, then the clinician must be prepared to also provide to the nurse the decision support number, the HCPCS code, and the HCPCS modifier. And lastly, if a test is considered an emergency, accessing the CDSM would not be necessary, but in the order in Point-Click Care, You should type in that this test is considered an emergency and that the CDSM was not consulted. So now I'm going to take you through the process and how this looks. We're going to start by doing this for the Holy Redeemer intranet page, which you can access while you're in the facility if you're connected to the intranet page remotely. This is the Holy Redeemer intranet page. You'll see the icon here for point-click care. Directly below that is the icon for the Care Select Imaging Program. You're going to click that icon. The first time you do this, you'll see over here on the right the registration page. If you click this, you will then be taken to the registration page where you enter the appropriate information to register, create a username and a password. Make sure you save that. Once you have access, the next time you go in, you will go to the login page. You'll enter your username, password. This will take you to the program. As we said before, you first enter the patient's age, then the sex. Try that again. And the sex was male. You're going to type the service information. So we're going to order a CT head. We're going to do that without contrast. So I'm going to come down to the CT head brain without contrast. They're going to ask me for the indication. For this patient, I'm going to type in headache. You'll see different choices. So I'm going to select for this patient headache, new or worsening. And then you'll see the score that is generated. So for my test of CT head brain without contrast for headache, it's giving me an appropriateness score of 9. Remember, if a low appropriateness score is generated, you will still be able to currently select this service. So I'm going to select the CT head brain without contrast, select this service, and as you can see, it's generated the decision support number, the HCPCS code down here, the G code, and the HCPCS modifier. To make this easier, you can just click copy to clipboard. I click copy to clipboard, I'm going to close. So now I have that information. I can exit the program. I'm going to go back to the intranet, and now I'm going to sign on to point-click care. Going to go to a test patient. Going to go to orders. Going to type in CT head, and we're going to do CT head brain plain. And you can see in the type of diagnostics box here, we have the CT head brain. We're going to type in the diagnosis or the reason. And remember, we're not going to use rule out. We're going to use headache in this particular case. I'm going to then paste. I right-clicked on my mouse. I clicked paste. And after I pasted, you can see all of the information that I was able to obtain in Care Select is now included in the type of diagnostic box. My decision support number, provider name, and down at the bottom, the HCPCS or the G code and the HCPCS modifier. So I have all that information that I need. We then have to go back down and make sure all these fields are completed to generate the order. Save the order, I reviewed it, everything's there. going to electronically sign my order. Yeah. Order is complete. The nurse will print this order out and she will fax it to the appropriate facility that's going to be performing the study. And there you have it. So that's our tutorial on how to use the CareSelect program and generate the appropriate information for your Medicare beneficiaries for advanced diagnostic imaging.